the meaning of the doctor, whether it's in a GP setting or a psychiatry setting or any other setting. The doctor is the all-powerful expert on your condition. And this really, really loads the encounter in a psychiatric setting of your meeting with the psychiatrist. I know on many occasions I've thought to myself, what is going on in my head? Why is it like this? Blah, 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 blah. Oh, all I've got to do is see a doctor and they'll be able to tell me and they'll know and they'll understand. That is not what I discovered when I went to see the doctors. And over the course of 20 years, I may have had 8 separate diagnostic labels attached to what was actually a continuous, complex mental disorder. Part of the reason why the labels were becoming different was because the words that I would use to describe them over time changed. Yes, this is and the hierarchy of the medical system generally in which psychiatry is placed means there's such a difficult hierarchical power dynamic between doctors and all the other staff who support psychiatric services, which I think is actually quite harmful. And in a way, it's like, are people prepared to get to break that power dynamic? You talked about open dialogue, Lauren, and that I think is where people are working with a patient on a flat hierarchy or on a circular, so all members of the team are similar at a similar level and are there primarily as human beings who are trained in this more therapeutic interaction with a single patient.
Going back to this idea of the doctor as a healer, which I think is very important. All societies have healers. They all have symbolic roles and functions. And I think doctors in our society also have symbolic power as well. It means something when a doctor gives a pill as opposed to buying something over the counter from Sainsbury's. And that has been tested in studies. So, the placebo effect is much more powerful if a doctor gives a pill as opposed to somebody else. So why is that? That's because of the symbolic role of the doctor as somebody powerful who can help you. And that is something which is not acknowledged or necessarily talked about. But I think that if doctors were to become aware of that, then they would probably become much more kinder and much more human, because they would be aware of the potential impact of what they say and the meaning they may have in somebody's life. And that would probably improve this therapeutic effect, which, Louise, you're talking about, which we need to work on. Part of that therapeutic effect is relationship. But we don't have that in our vocabulary, especially in the way that services are designed. They're so fragmented. So you have somebody seen in accident emergency department, they're then seen by a liaison psychiatrist, then by an inpatient doctor, then by a home treatment team doctor, then by a community consultant, and then discharged back to their GP. And that's supposed to be a pathway, which is completely fragmented.
A very traumatising pathway for some people, quite a lot of people. I think in mental health services more than in any other, the paradox is there are many people who are like the walking wounded, not only from their disorder, but also from the way they've been dealt with by services, which is incredibly tragic, because that's not only missing an opportunity, it's doubling the problem that services purport to support and treat.